Good afternoon, everyone. My name is Maya Luria with TMC for Seniors. Today is a twofer. I've been on twice. We had a presentation this morning. We've got another one this afternoon. I want to welcome Dr. Peter Lee here. He is with Arizona Oncology. And Dr. Lee, you always give us the topics that really we need to know about. Today it is running away from the runs. And so I welcome you here. Thank you for being here again.
Thank you for having me. I was saying that I got all the great topics here to talk about, but I think that it's important. And the problem is nobody likes to talk about it, and that's why it remains a mystery. I'm trying to make that more clear for people. So our topic today is about diarrhea. So in this talk, we'll go over what is normal, causes, management, and that's going to take the bulk of our time, even though it's only three little things. Diarrhea is a very wide topic. So many things can give rise to diarrhea. And so we have to make sure that we know what we're talking about and dissect it. So what is a normal bowel movement? Everybody sort of remembers this. Well, no, my daughters remember this book. It's a book, I think, written in the 80s from Japan, and it's about, that everybody poops. And then the catchphrase is everybody eats, therefore everybody poops, but everybody poops differently. Okay? So, when we talk about what the normal bowel movement is, questions that we ask are, how often does it occur? Are you an everyday kind of person? Does it happen multiple times in the day? We can also be talking about what is the consistency of your stool, okay? Is it hard? And what does hard mean? And what does soft mean? And then other stuff. Is it related to, is there other stuff in there? Mucus? Is there blood? Is there undigested food? That's what basically we're referring to. So Dr. Oz was on Oprah, I think in 2005 or 2006, and he actually had dedicated a whole episode about bowel movements. And you can probably find this episode online. And he says, and this is straight from the episode, first, what is the sound of the poop that it makes when it hits the toilet water? You want to hear what the stool or the poop sounds like when it hits the water. If it sounds like a bombardier, plop, 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 that is not right because it means that you are constipated. It means that the food is too hard by the time it comes out. It should hit the water like a diver from Acapulco hitting the water, a swoosh sound. That was Dr. Oz, okay? Second thing is he also commented on the shape. And I've actually had this read to me or spoken to me when I'm interviewing a patient, and that Dr. Oz had mentioned this. It should be an S shape, and you want to make sure that the color is normal because the color of the poop tells you a lot about how you made this. You don't want it in pieces. If the stool is in pieces by the time you finish digesting your food, then you don't have enough of it left to poop out in the right way, and it's probably going to hurt the colon that has to process it. At the end of the day, you can analyze your body really effectively by looking at what comes out of your body. Those were his words. So he actually had a graphic on there, and this is sort of what it looks like as the stool is emptying out from the small intestine into the colon. As you know, you eat your food. If you eat dry foods like, crackers, you need to wash it down with fluid and things like that, okay? But also your stomach will make digestive juices, that's extra fluid. When it gets into the small bowel, the pancreas and the liver will make some digestive juices, and that will enter in there. So by the time it's in the small bowel, and you also have chewed it up really, really fine, it's basically watery. When you do a colonoscopy or you do surgery on somebody who has bowel obstruction, most of this stuff is water, okay? And it's liquid. And I usually say that, it stays that way throughout the small bowel to make it easier for the small bowel to absorb the nutrients and whatever is in the food, throughout as the food goes through the small intestine. It's like a sponge soaking up the nutrients that are there. When it first dumps into the cecum, or the first part of the colon, it's usually liquid. And the colon's job basically is to reabsorb most of that water and electrolytes and things like that to turn it into a solid stool. So when you have diarrhea, it could mean that your colon is diseased, has an infection, enteritis, a viral disease, something like that. And it just doesn't get a chance to, reabsorb the fluid. And that's why it comes out as water by the time it hits your rectum. Sometimes people have ileostomies instead of a colostomy, where the small bowel is brought up to make the bag, for them to eliminate their waste, and it comes out as a liquid. So I like this picture because it usually is going over what stool looks like. And since I'm a colorectal surgeon, our interest here is about the colon, okay, and its job. Some of you may be familiar with this thing called the Bristol stool chart. I've seen it get handed out a lot by the gastroenterologist and some family physicians, and as a way to characterize your stool. Not what Dr. Oz says, but this might be a little bit more objective. It's a scale from 1 to 7, okay? And you can find this online. And actually, your printout should have a copy of these pictures. And I already have patients coming to tell me, oh, I'm a stage 4. I score 4 on this chart, and this gives me some idea in terms of what your stool's like when you come to see me for some sort of evaluation. The healthy ones are considered 3 or 4, and then this is sort of bordering on diarrhea, and this is bordering towards constipation. So we'll be mainly talking about this side today. Why is this not advancing?
Honestly, I didn't do it. Honest.
Did it before. Oh, there you go. All right. So the emoji for stool is that. All right. It looks like a soft serve ice cream, but actually, this is not normal poop. This is actually considered on the diarrhea scale of things, okay? And Dr. Oz is right, the S-shaped thing, that's fairly accurate when we want to describe normal poop. And you want to look at the color. Unicorn poop is usually rainbow color. I got this from my daughter's book. That was interesting. But it's always, this is the universal emoji for poop. So what is my definition? Okay? But I have to say that everybody's going to be different when it comes to whether they have normal stools. All right? What's a normal frequency? Some people it's a couple times a day. For some people it's once a day, every other day, twice a week. I would say anybody who has it less frequent than twice a week, that would be bordering on constipation. But it really depends on people's diets, whether they drink coffee. Some people have a certain routine down, and if it's something that they lived with all their life and it doesn't seem to be maladaptive, I would consider that normal. So every patient is going to be different when it comes to what constitutes a normal frequency of stool. What is a constipated stool? Well, the picture of the log sort of says it all. It's usually big, it's cracked at the surface because it's dried out. It's spent too much time in your colon for the water to get reabsorbed from it, and then by the time it gets to your rectum, it's just this big log that it's really hard to poop out. It's not very pliable. It's not like soft or can't bend it or anything like that. So that's what I would consider a constipated stool. And this is sort of what they talk about when they're doing that Bristol scale. Another definition is small pellets. I liken this to rabbit pellets. And when I say rabbit pellets, people immediately know what I'm talking about. And this is actually a picture of rabbit pellets from an actual rabbit from some rescue bunnies website in San Diego. But I thought that this is sort of, so this would be similar to what I would consider somebody who is constipated. That all you can poop out is little round balls. And a lot of people would talk about that and describe that when they're constipated. For me, what is the definition of a normal stool? Smooth surface, easy to pass. It slips right out, like that diaper that they were talking about. To me, it's like nice bratwurst on the grill, greasy, slimy on the outside, slips out really easy. And for me, it's easiest for me to describe consistency of stool using food as a reference, okay? So, and I feel like that's more relatable to patients than trying to talk about rabbit pellets, a log or something like that. I talk about food. So diarrhea for me would be this. This is split pea soup. It's usually this color. And sorry if I'm ruining split pea soup for you guys. But this is the thing that automatically comes to my mind when I think of diarrhea. It's loose, it's watery. Sometimes there's chunks in it. And other people just have straight water. There's no chunks in it at all, okay? So this is what I would consider to be diarrhea. So we'll be talking about this kind of stool. And then the other things we talk about, is there blood, is there mucus, is there other things in it? So what can diarrhea cause? What are the complications of diarrhea, all right? Well, because you're going so often, you're probably wiping your butt more than normal. You're wiping it 4 or 5 times a day. The other thing is because it's watery, it's sometimes harder to wipe it off because you feel like, oh, there's a little stain in there. Oh, let's just wipe some more. And then pretty soon, it's like having a runny nose and you're using the tissues like a lot, okay, to address the runny nose. And so you get this surface irritation about your nose. And I think the same sort of thing is happening at your anus because you're wiping it so much when you have a bout of diarrhea. So you get irritation, pruritus ani is a fancy word, you get itching, okay? You can get an anal fissure, you can have pain from the irritation or a separate pain that's like related to the fissure or other things. When you're wiping so much, you can also cause excoriations or little scratch marks that are stingy, and you would have that razor blades feeling down in your rectum or your anus, and obviously bleeding if you keep wiping and those turn into ulcers, and the skin down there has a lot of good blood supply. Another problem with diarrhea is incontinence and leakage. So I always talk about, it's harder to be continent of stool the more liquid it is, okay? And it's sort of like when you run your water, when you put your hands under a faucet and you want the water to be held in your hands, you got to do some maneuvering to get that water to not leak through the spaces between your fingers or between your hands. Whereas if I poured a bag of M&Ms on your hand, well, it's solid, so it's much easier to hang on to those M&Ms, okay? So with people, when it comes to incontinence, even if you had normal sphincter tone, it's still kind of hard because, when you're driving down the highway and there's no bathroom for a while and you're just doing the squirming and trying to control and keep that sphincter closed, it's harder when you have liquid as opposed to a more solid bowel. And as people age, their pelvic muscles atrophy and they get more incontinence type issues, especially with diarrhea. You can get the cramps from abdominal pain. The things that worry us as physicians most is the complication of dehydration and getting electrolyte abnormalities. You can become profoundly dehydrated, even with just normal viral gastroenteritis, and to the point where you need dialysis because your kidney shuts down because you're so dried out from all the diarrhea. You can also get severe electrolyte abnormalities like hypokalemia, hypomagnesemia, and get cramps and headaches and all these other things. Chronic diarrhea can also cause weight loss just from malnutrition because everything's just going right through you. It's just not sticking around and you're not absorbing anything. So those last two things are the main things that make us worried when somebody has uncontrolled diarrhea and needs some sort of control with that. What causes diarrhea? Unfortunately, the list is huge. I will start with dietary causes, okay? Common stool thinning foods I'm going to say spiced foods, spicy foods, a lot of hot peppers, because what happens is when you take it, your body thinks it's on fire and actually secretes more digestive juices to sort of digest that spice, the capsaicin. Another thing is alcoholic beverages, grape juice. These things, when taken in moderation, it's okay, but in excess can cause diarrhea from all the secreting things that try to digest this. Another common thing that we see is in a lot of processed foods. Sorbitol and other sugar alcohols, which are usually a lot of the sugar substitutes. There's one, I think it's called Alanol or something. You have to look at the ingredient label. A lot of times the ones that are like less sugar or whatever, they replace that with one of these sugar alcohols, which actually acts like a laxative. Sorbitol itself is a laxative if taken in large quantities. So basically you're just forcing yourself to have diarrhea when you consume a lot of these foods. So it's important to read the nutrition labels to figure out what some of these chemicals are that they're putting in it, especially in the processed foods, because they can cause diarrhea. There's also a lot of different types of intolerance. Now, I don't want to overwhelm you with what's on this slide, but the most common one that people talk about is lactose intolerance. When you're a little baby, you tend to take lactose, but then you stop making the enzyme, so then, the lactose, and the same thing is same as sorbitol. It's acting as an osmotic agent. What does that mean? This is something that's inside your colon and or your bowel. It's hanging on to water, and so by hanging onto the water, it doesn't allow it to get reabsorbed back by the colon or the intestine. So it stays within the lumen or the inside of the colon, and then by the time you just have a lot more volume that you have to poop out because it never got reabsorbed because it's hanging onto that inside your stool. Lactose is a common one. You may have heard something called FODMAP. It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So this is the lactose. This includes lactose, galactose fructans, and then polyols, which are the sugar alcohol things, okay? There are so many sugar substitutes out there that I sometimes have to look it up to see whether it's one of these that can cause it. So to me, I just say most of the artificial sweetener things can cause this, but I'm not 100% sure. I have to actually look them up every time I encounter this. And lastly, you could have something called celiac disease. This is the gluten intolerance. This is a slightly different mechanism of diarrhea, though. Gluten is something that I guess it could be an allergy in this situation. What it does is it messes up the lining of the small bowel and allows. So normally the small bowel has a very big absorptive area, and I think it's like a centimeter squared has like a tennis court, if you unravel all the surface area for it to absorb, it's like a tennis court or something like that. That's just an estimation. But when you have, in people who have celiac disease and are exposed to gluten and gliadin, they make antibodies and stuff, and it messes up and reduces the amount of absorptive surface in your small bowel. So what ends up happening is then it doesn't get absorbed, it stays inside the small bowel, which means that there's a bigger volume for the colon to have to deal with, and then so you have to diarrhea later. So these are the intolerants. So the FODMAP diet is basically don't eat apples, the lactose, legumes, asparagus. I think this is mushrooms, watermelon, honey. There's so many other things that you got to look it up to figure out what is the low FODMAP diet. Okay. Infectious causes. Norovirus, rotavirus. I have a cruise ship here. It's very common to get it when they have some sort of contamination. You hear about those outbreaks at the salad bar or whatever. It's usually gastroenteritis. You can have colitis or proctitis, which is inflammation of the colon. It could be an infection. You could have E. coli or Shigella. These are the infectious ones that, improperly canned jams, and you see that at when they talk about at the state fair and somebody got poisoned from some of this stuff. This is that. They make a toxin. Another thing is C. diff. C. difficile is a very common infection, and it's associated with taking antibiotics, wiping out your colon, and then this opportunistic, bacteria gets in and it starts creating this toxin that causes your colon to shed the lining, and then it can't absorb, and then you get this diarrhea, and you can actually die from that. Okay. Antibiases, giardias from drinking, like if you go hiking and you drink the water that's in the stream, and there's these parasites that live in there, and there's other, what is it? What's the word for that? I guess it's just parasites, okay? Not bacteria, just some parasites that could be contaminating water sources, because normally when we drink water, it's been gone through a water processing plant and stuff. Medications also have side effects. The problem is there are so many medications that list diarrhea as a side effect, but I'll go over the common ones. Metformin for diabetics, antibiotics for sure. The reason why antibiotics do that is it wipes out your normal colon, and then so the bacteria aren't there to eat up, any waste or anything that's in your colon, and then you just can't absorb a lot of stuff, and so you end up getting diarrhea. Antidepressants can do it, certain ones. Antacids and PPIs. So a risk of getting the C. diff is when you take the ulcer medications like PPIs and certain types of antacids, you're neutralizing one of the defenses you have from ingesting bad organisms. Your stomach is really acidic, and it's, it can sometimes digest the spores or whatnot of some of these bad bacteria that causes colitis. And so if you blunt that response, or blunt that ability to make acid in your stomach by taking these medications, that can make you more susceptible to things like C. diff. Magnesium. So a lot of people take magnesium to help with constipation, because magnesium itself can act as an osmotic agent. Milk of magnesia is something that people take when they're constipated. It's a laxative. It's a very high dose. Some people are taking magnesium for spasms and things like that. And if you take too much of it, it can be a side effect. Chemotherapy can do it. Chemotherapy messes up it attacks very actively growing cells in your body. So what can happen is then, because the lining of the bowel is turning over at a very high rate, these are targets of chemo, and then they just slough off, and again, you don't have the ability to absorb the fluid, the nutrition, and then that can be a side effect. And then lastly, ACE inhibitors, which are certain kinds of blood pressure medications to treat high blood pressure. They include like ramipril. It usually ends with the letters IL, okay? And if you take that could be a side effect. Even constipation can result in diarrhea. So how does somebody get diarrhea, get constipated? Well, this is just a schematic. Sometimes what happens is you have a giant rectal stool ball that's just sitting there and it won't come out. What happens is it's stuck, but all the liquid stuff just leaks around it and then just comes out much easier. And so that sometimes can see constipation. So I've seen patients who have diarrhea, but what they actually have is a fecal impaction. And you have to first get rid of this, either with laxatives and enemas, and then let the diarrhea run out, and then it gets better on its own. Colon cancer. This is one of those that people worry about, and it has treatment. And so that's why we're going to say that if the diarrhea doesn't go away, you probably need to have somebody check it out if you haven't, okay? So colon cancer, sometimes it leads, I don't know what the actual mechanism, but I just know that, sometimes you have changes in bowel habits because of how stool or feces are going through your system, and it results in diarrhea. And then chronic disease, and these include Crohn's disease, ulcerative colitis. Again, this is inflammation of the colon, so it can't absorb because it's inflamed. There's something called microscopic colitis, where you can't, when you look at it, it looks fine on the colonoscopy, but when you take a biopsy, something shows up, it shows inflammation microscopically. And then another one would be pancreatic insufficiency, or if you've had your gallbladder removed. And so gallbladder, people who've had that gallbladder removed often will get diarrhea or more frequent loose stools, because the way that the gallbladder works is it hangs onto the bile until you're ready to eat. And when you eat, it squeezes and you get all the digestive juices out at that time. When you don't have your gallbladder, basically your liver is making the digestive stuff at a constant rate, just sort of leaking out into your small bowel. And so when these salts get into your colon, it irritates it and causes diarrhea. With pancreatic insufficiency, you get something called steatorrhea, because it doesn't make an enzyme that digests fat. And so these people will have stools that are really high in fat, have a lot of bile salts and stuff like that, and then they actually float in the water when it hits the water. Another one, I'm sorry if I'm overwhelming, there's just so many, the list is so many. Bacterial overgrowth. So this is from if you're taking medication or you had surgery that alters the anatomy of your intestinal system, and things just go much slower through your digestive system. Well, if it stasis and just sits there, then bacteria can overgrow in that area and cause problems, and they cause inflammation, and then you get this bacterial overgrowth from diarrhea. If you take a lot of narcotics and stuff like that, sometimes that can do this too, because narcotics, medications that slow down the bowel, or stuff going through the bowel, can cause this condition. And lastly, basically this is everything else that we have diarrhea and cannot find any obvious reason for, and it's irritable bowel syndrome. It's usually marked with cramping, pain, diarrhea. Sometimes people have constipation, and some people say it's related to stress or the type of bacteria that live inside your gut. The problem is that this is one of those things that is very poorly understood, and we're sort of right now we're in the realm of trying to study what this last thing is, gut microbiome. Everybody here has maybe a different population of bacteria that live in their colon, okay? And it might work for you, but some people take probiotics to sort of make it more healthy. And some people do find benefit in making sure that certain types of bacteria in their body in order for them to have like normal bowel movement. The mechanism is still very poorly understood. Right now, I think that's going to be the next realm of research. That's what we're going to find out. who needs what in order to have normal bowel function. I'm going to end today with talking about management. Now, you saw that list was pretty long, okay? And it's not your job to figure out what's wrong with you. It's our job as physicians to figure out what's wrong with you. But because this is such a common problem, you probably should start somewhere, okay? And it will help narrow stuff down. So I would, if you have diarrhea, most episodes of diarrhea are self-limited. That means that it'll go away after a couple days, and you can start conservatively, a bland diet. When you guys, brat diet is something that we often give little kids when they have diarrhea, which is basically banana, rice, applesauce, and toast, okay? Sometimes a high fiber diet will help you with diarrhea. So taking Metamucil, or some of those, fiber supplements. What it does is, I often describe it to my patients as like kitty litter. It bulks it up, like it clumps up, and then so that you won't lose so much fluid. All right. So I feel like those are things that you can start with to see if you can control your symptoms. You can take anti-diarrhea medications like loperamide, which is Imodium. There's kaopectate, which is more of a binder type agent. Pepto-Bismol is another one of those medications that can help you manage the diarrhea symptoms. I would never start at a really high dose. Always start at the lowest dose and work your way up. Some of these medications work very well, and some people are very sensitive to it, that it can turn a diarrhea problem all of a sudden to a constipation problem. And what ends up happening is that people tend to take a laxative, and then you're just playing this yo-yo game, and you're just paying for it when you do that, when you go from one extreme to the other. So always start at a low dose and titrate up. A lot of the medications will tell you that you shouldn't take it more than a week. And I agree with that, because if it's still persistent, then there's something else that's wrong, and that these medications are not really taking care of your symptoms. We mentioned before that the things that we worry about is the dehydration. So make sure you're drinking plenty of sports drinks, things salty, like broth and things like that. Sports drinks, Pedialyte. For those of you who have children and they get diarrhea a lot because they're always at school picking up stuff, these are the sort of things that you would do when your children have diarrhea. You should always monitor yourself for signs of dehydration. Some of those include dark urine, lightheadedness because your blood pressure is low, or weakness because sometimes you get a spasm in your arms, in your hands because your electrolytes are low, and you get cramps. So when you have some of these symptoms, I think that usually you might need to go to the ER and get IV fluids to replace, because sometimes what happens is initially when you're dehydrated, or let's say somebody has diarrhea, so okay, I'll just drink more fluid. Well, let's say they forget, and then the dehydration becomes profound. A common side effect of the dehydration is nausea. And now you're nauseous and you're trying to keep things down, and you can't do it because you're nauseous. And then it might even progress to the point where you're throwing up. So now you're coming out of both ends. And then that's a real quick way to get really profoundly dehydrated. So the only way in that situation to get rehydrated would be IV fluids. And then you'll have to get it at the ER or urgent care or something like that. If it's not improving, if you're getting weight loss, you're getting lightheadedness and you're throwing up and you're starting to have bowel pain, and you're getting blood in the stool sometimes, it's time to say we need more help now, okay? This is when you got to call the doctor or go to urgent care or something, so that they can get this process started to figure out, well, what is the reason for why acutely, and again, if you've had diarrhea or loose stools for a long time, this doesn't apply, but like for years, but this is something that's new. We have to make sure that we're ruling out all the crucial acute problems. They're going to do a history of physical. They'll ask you, have you been traveling recently? A lot of the viral gastroenteritis are self-limited, but you may still need to have IV fluids if you're profoundly dehydrated. They'll do blood work. they may check a stool sample. They may go simply for a CAT scan or, to see if there's some colitis on there. And if all of that stuff is normal and don't find any serious acute thing, they likely will send you to a gastroenterologist for further evaluation. What's the gastroenterologist going to do? Well, these are the things at their disposal. They can do endoscopy, which includes EGD, a colonoscopy. They might do further stool testing. They're looking for like inflammatory bowel disease, like Crohn's or ulcerative colitis. They may start you on a FODMAP-free diet. Okay, so that list of the apples or whatever that we were looking at before, they will start you on, and then after being on that diet for a period of time, hopefully your symptoms improve, and then you got to figure out which is the offending factor that causes you to have that particular diarrhea reaction. So it's like checking for allergies. It's probably different for different people. So that's why then you stop it and then slowly reintroduce certain foods back. And then once you know that it doesn't affect you, you can continue that. Bacterial overgrowth test, I believe, is some sort of a breath test. When they do the endoscopy, they will probably check you for celiac disease. They'll take a biopsy. And actually, there is a celiac disease test with a blood test that they can do as well. And then if nothing really figures it out, then you probably have IBS. And even with IBS, there are some medications that are effective, that they have more experience with more than me. And then they'll just treat you after the diagnosis is made. So I think we came to the end of our list. So I want you to take home today with diarrhea is one of these things that happens to everybody. It's very common. Most of it is self-limited. I would start with a conservative management, fluids, anti-diarrhea medications. When you take the anti-diarrhea medications, start low and go up. If things aren't getting better after a week or so, or you start getting other problems like nausea, weight loss, worsening of dilating blood, weakness, it's time to get some help to let us figure out what's wrong with you. I'm ready to take any questions.
Hi, Dr. Lee. Thank you. So I have a couple of questions that came in. Can you tell if you have a certain number of loose or watery stools, do you have to have so many in order for it to be considered diarrhea? Or
I missed the first part of your question. What?
Oh, I said if you have a certain number of loose or watery stools, do you have to have so many before it would be considered diarrhea?
So that's a hard question to ask. So what is a loose stool? So to me, a loose stool is, I'll use the food analogy here. It's cow patties or mashed potatoes or soft serve ice cream. So if you had one, okay. If the next one is normal, you don't have diarrhea.
Okay.
But if it's a pattern that's been going on for a while, now it's different. The people who are at most for getting the dehydration are the people who have the watery stools, okay? For that split pea soup, you need to make sure you are hydrated. If you have soft serve ice cream, you just have loose stools. That's usually either related to diet, and most of those can be better addressed with just taking a fiber, and that will just bulk it up just that little bit to make it not so loose.
Okay. And what about the color of the stool? Does that tell you anything along with the consistency? Does that matter?
Okay, so the colors that we worry about are white or gray, or red, or black, or maroon. The latter would tell you that you have, something bleeding. It could be colitis. It could be something like that. White or gray stools are usually related to something, maybe pancreatic or some bile ducts thing where it's not digesting enough. It's not making the bilirubin. And so every other color, green, yellow, orange, is basically okay. I don't know whether that lists. I'm sorry, I just spilled some water here. I'm sorry. I don't know what that means because that would be some range of normal in my mind.
Okay.
So White, gray would mean some sort of bile duct problem, okay, to give you diarrhea or give you that color kind of stool. And red, maroon, I guess purple, bloody, and black. And now black is not dark. Black is the color of my clothes. It's like jet black, ink black. That's what we're talking about when we're talking about black stools.
Okay. Now, I just had another question come in. What do you recommend when diarrhea and watery stools have been going on for a long time? Like I'm talking decades. And the GI doctor worked you up, didn't show anything, and just says to take Imodium. Can that be something that can be taken daily, or is that something that shouldn't go on for a long time?
So when you're starting out and you have not had the workup yet, then no, I would not just keep taking that until, for a long time. But if you've been worked up and all the bad stuff has been rolled out, unfortunately, sometimes that's what you end up doing, having to do.
Okay.
And this could be related to IBS. I mean, I don't know if they've tried them on some certain types of IBS medications. Some of them might be expensive, and so the fallback would be the Imodium or something like that.
Okay. Can you just share where you're located, Dr. Lee? If somebody wanted to come and see you, just, where's your office?
We're right across the street on the other side of Palo Verde, right next to the Catalina.
Right where TMC for Women is located. Yeah, so yes.
That's the cancer building.
Yes. Okay. And that's where your office is located.
Yes.
Do you have the phone number for your office?
It's 520-416-5700.
Okay, great. All right. That's perfect. Thank you so much for being here. I'm going to wrap up with our online audience, and I'll turn it over to you for any questions in person. I want to thank you so much for being here. And really, you discuss all the things that people don't always talk about that we really need to know. So we appreciate you coming today. Thank you.
Thank you for having me.
Thanks. Thanks again for being here. We will be back next week on, oh my goodness. Sorry about this. On Wednesday, March 12th for Deciphering the 4 Ds, Decline, Depression, Delirium, and Dementia. That'll be Wednesday, March 12th at 10 a.m. If you're interested in that class, please give us a call. We'd be happy to get you registered to either attend in person or online. The phone number is 520-324-1960. Thank you.